invasion by bacteria found in the gut. Obstruction may be, as I already mentioned, the normal mucous secretion continues in the lumen of the appendix, thus causing further build-up of interluminal pressure. It leads to occlusion of lymphatic channels, then venous return is compromised, and finally arterial supply. And it reduces blood supply to the wall of the appendix and leads to less supply of nutrition and oxygen, and less supply of WC. As we know, this WC is a natural fighter against infection. So these things are less supply to that organ. So putrefaction occurs, and bacteria, the gut bacteria, they take the upper hand, and it leads to gangrene and further fluidinitis, etc. Thus, the wall of the appendix starts to break off and rot, and bacteria take the upper hand. Coming to signs and symptoms of acute appendicitis, pain is the most common feature of appendicitis. Pain, fever, and nausea and vomiting. These are three triad constitute appendicitis. So this pain is basically caused by distension of the wall of the appendix. This distension causes stretching of the peritoneum and causes pain. Later, when the grossly inflamed appendix rubs on the overlying parietal peritoneum, and then with spillage of content of appendix to peritoneal cavity, giving rise to peritonitis. So these are the basic cause of pain in appendicitis. And some cases, this is the clinical where the pain starts and localizes. Some cases start as umbilicus and localizes at a classical teaching for appendicitis. But some cases, the pain starts in the epigastrium also. We think it to be peptic ulcer disease or pancreatitis, but it localizes later to radial and some cases start at right at the radial ulcer at the appendicular McBurney's point. Depending on the position of the appendix, the pain could be at the flank also. In retrocecal appendix, we get pain at the loin, posteriorly. Dysuria and frequency of urine patient may have if long inflamed appendix tip is in the pelvic cavity and irritates the bladder. The patient may have dysuria and hematuria. Pain in the scrotum has also been reported due to retroilial appendix. In pregnancy, the pain could be anywhere in the abdomen because the gravid height of the uterus pushes the appendix off and you cannot localize at any point. So, whole of the right side of the abdomen in epigastrium, right hypochondrium may get pain as the uterus pushes it off. And pain is continuous, worsens by movement and reduces on lying still on the bed. So, if patient is rolling down with pain, probably it is not appendicitis due to some other colic, maybe urinary colic, in which is a different diagnosis of appendicitis. But in appendicitis, patient tries to remain still so that the inflamed peritoneum is not disturbed to cause the pain or increase the pain. Fever. By release of toxic materials like the endogenous pyrogens following necrosis of the appendix wall and later by pus formation. But fever always follows pain. If fever is there initially and then patient develops pain, it is probably not appendicitis. So in those cases, you think of some other causes of abdominal pain like enteric fever. In last couple of months, we got 2 cases. They were admitted in my ward. They were having fever for 4 to 5 days, and patients are referred to us as abdominal pain. They are admitted in our ward, surgical ward. But fever was for 4 to 5 days earlier to the admission, and pain developed later. There was tenderness in radial ulcer. And during that period, we did a blood culture, and Honor will say, because all those 2 cases, salmonella were positive. So they were treated as enteric fever and it got cured. So all radial ulcer pains are not due to appendicitis. So when fever precedes pain, you think of something else other than appendicitis. These are the early symptoms of appendicitis: right lower abdominal pain of gradual onset, feeling sick with nausea, with or without vomiting, and loss of appetite. Loss of appetite is the most remarkable feature. If the patient is having good appetite, probably we are not dealing with acute appendicitis. There may be change of bowel habit. The patient may have diarrhea, may be constipation. If the inflamed appendix irritates the colon, then it may cause diarrhea also. Fever, as I already told, there may be low grade fever, and 20% patients are having normal temperature. If temperature is more than 38.5 degrees centigrade, it may be suggestive of ruptured or operated appendix, appendicular abscess, or in these cases, as I told, enteric fever to be ruled out from the history and investigation. Pain in scrotum in a newborn, if the appendix moves to the scrotum with a congenital hernia, it may cause pain in the scrotum also. And hematuria, I already mentioned. Tenderness and guarding. Magmanis point, it is a typical site for tenderness. You will see tenderness in the case of appendicitis. This is the junction of the lateral third with the medial two-third of the line joining the anterocipitalis spine to umbilicus. So this is the typical point. And we get sometimes rebound tenderness. The pain is worse when the hand is suddenly removed from the point of tenderness because the inflamed appendix is rubbing against the parietal peritoneum. And rupturing signs: pressure on the left lower abdomen causes pain in the right lower abdomen. In pelvic appendicitis, sometimes for rectal examination may cause illicit tenderness. And Schwartz sign: the hip is moved and stressed. This can also cause pain at the spot where the appendix lies. This is the Schwartz sign. This is the iliopsoas muscle getting inserted in the femur. This is the inflamed appendix. This is the cecum. So if you extend the stressed lower limb, patient will get pain here. So this is called Schwartz sign. The obturator sign is another sign. This is the obturator insertus muscle which also gets inserted to the femur. This is the cecum. This is the appendix. In the flexed hip and knee, if you internally rotate the hip, then patient experiences pain. This is the obturator sign. So coming to investigations, there is no one test that can for sure confirm the suspicion of appendicitis or this could be. So you have to seek for the clinical signs and history. Coming to blood.